Hello, ladies and gentlemen. Hello, everyone. This program, Efruzhu Oncotherapy, Dosage, Theoryem and Lawsadvocates, step-by-step, conventional, some drugs, medicines, detailed program. Azacitidin, vidaza, hypomethylating agent. Azacitidin, vidaza trademark. Drug class, antimetabolite. 5-azacitidin induced hypomethylation of DNA, which may either induce apoptosis or restore normal function. At higher doses, it acts as a citidine analog. Dosage form 100 milligram. 100 milligram vial of lyophilized powder. 100 milligram vial diluted to 20 milliliter in sterile water, and then rapidly diluted to a final concentration of 0.2 to 2 milligram milliliter in normal saline or 5% dextrose in water. Drug interactions none noted. Pharmacokinetics metabolism not orally bioavailable, not orally bioavailable, metabolized by the liver and excreted in urine. Elimination half-life of 4 hours. Toxicity. Myelosuppression is dose limiting. Leukopenia, thrombocytopenia, and transient elevation of liver function tests are common. Nausea and vomiting and abdominal pain are common. Indication: myelodysplastic syndromes, but we would like to use general because cancer cell generally normal DNA genes hypermethylated, and we need to hypomethylating agents, DNA methylating inhibitor, azacitidine, 5-azacitidine, 5-aza-2-deoxycitidine, for instance, decitabine. Dosing 25 to 100 milligram meter square for 7 days, repeated every 4 weeks for 4 to 6 cycles. Dosing 75 to 100 milligram meter square for 7 days. Repeated every 4 weeks for 4 to 6 cycles. Another drug medicine, Bexarotene, Targretin, trademark, Bexarotene, Targretin, drug class, synthetic retinoid differentiating agent, drug class, synthetic retinoid differentiating agent. You know, cancer cell immature, undifferentiated. These drugs should be cause differentiating maturation way effect. Dosage form 75 milligram capsules. Dosage form 75 milligram capsules. Drug interactions, no formal studies done. Drugs which inhibit cytochrome P450 3A4, such as ketoconazole, erythromycin, and gemfibrozil, expected to increase plasma level and half-life of Bexarotene. Known to decrease plasma level of tamoxifen with concomitant administration. But tamoxifen our 9 regimens not existence own role. Pharmacokinetics metabolism, good oral bioavailability increased by a high fat meal metabolized in the liver to oxidative metabolites by cytochrome P450 3A4 glucuronidated, eliminated in the bile. Toxicity, hyperlipidemia is dose limiting and should be monitored while on the therapy and treated as appropriate. Pruritus, leukopenia, diarrhea, fatigue, headache, and liver function test elevation can also be dose limiting. Rash, edema, fever, chills, and nausea, and uncommon excessive bleeding and back or abdominal pain are rare. Indications: FDA, Food and Drug Administration, approved for treatment of cutaneous T-cell lymphoma, mycosis fungoides, refractory to at least one prior therapy. Dosing 300 milligram meter square day orally. Dose in adjusted for toxicity. Dosing 300 milligram meter square day orally. Dose adjusted for toxicity. Another drug medicine, isotretinoin. Isotretinoin acutane trademark. Isotretinoin acutane 13 gis retinoic acid, shortly 13 CRA. Drug class. Isotretinoin is a retinoid derivative of vitamin A that binds to specific nuclear receptors and leads to changes in gene expression. This results in apoptosis or differentiation of many malignant or premalignant cell lines. Dosage form 10, 20 and 40 milligram capsules. 10, 20 and 40 milligram capsules. Drug interactions non-noted. Pharmacokinetics, metabolism. Oral bioavailability is about 25% and the drug is highly protein bound in plasma. It is metabolized in the liver and has an elimination half-life of 10 to 20 hours. Parent compound and metabolite are excreted in both urine and feces. Toxicity. Isotretinoin is teratogenic and should not be given to women of childbearing age. You know, the first trimester, teratogenic happening, teratogenic pathogenic development, sensitive period. Others from others drugs and medicines. Toxicity. Isotretinoin is teratogenic and should not be given to women of childbearing age without adequate contraception. Mucocutaneous side effects are common and dose limiting and include xerostomia, stomatitis, conjunctivitis, dry skin, pruritus, cheilitis, rash, patchy, alopecia, fragility of nails and skin, photosensitivity, and epistaxis. Nose bleeding, epistaxis. Other less common side effects include elevations in transamines and bilirubins on frank hepatitis, hyperlipidemia, nausea, vomiting, anorexia, diarrhea, headache, fatigue, depression, and myalgias, arthralgias, anemia, and pseudotumor cerebri are rare. Indications: Food and Drug Administration approved for acne vulgaris, has shown some effectiveness in chemoprevention of aerodigestive malignancies. Ongoing studies are testing its chemopreventive potential in other malignancies. Dosing: daily oral doses of 0.5 to 4 milligram kilogram day have been used in the chemoprevention trials for duration of 2 to 6 months. Dosing: daily oral doses of 0.5 to 4 milligram kilogram day have been used in the chemoprevention trials for durations of 2 to 6 months. Another drug medicine tretinoin, vezanoid, tretinoin, vezanoid, ATRA, all trans-retinoic acid. Drug class: a naturally occurring retinoid, induces differentiation and apoptosis of malignant promyelocytes in acute promyelocytic leukemia. Dosage form 10 milligram capsules. Dosage form 10 milligram capsules. Drug interactions non-noted. Pharmacokinetics, metabolism. This drug has good oral bioavailability and a very short elimination half-life of about 40 minutes. It induces its own metabolism in the liver, leading to decreased levels and clinical effect with continued administration, no appreciable excretion of the parent compound is evident. Toxicity: tretinoin is teratogenic, so women of childbearing age who take this drug must be on optimal contraceptive measures. Leukostasis and hemorrhage due to leukocytosis are dose limiting but uncommonly life-threatening if the drug is stopped. Retinoic acid syndrome, although not common, can be dose limiting and consists of fever, chest pain, dyspnea, hypoxia, pulmonary infiltratus, and pleural pericardial effusions. It can be lethal but improves with cessation of the drug and is treatable with corticosteroids. Dry skin, exfoliation, xerostomia, and cheilitis are common. Elevation in the liver function test and hyperlipidemias are also common. Headache is often seen, but pseudotumor cerebri or other neurologic occurrences are uncommon. Indications: Food and Drug Administration approved induction therapy for acute promyelocytic leukemia, also of benefit in maintenance phase of the disorder and may have clinical activity in other hematologic malignancies. Dosing for induction: the dose is 45 milligram meter square day per osmouthway for 30 to 90 days, depending on the clinical response. I would like to say again, dosing for induction, the dose is 45 milligram meter square day per dose for 30 to 60 days, depending on the clinical response. That's all this program, and we will be continue step by step, and at the end design and plant absolute cancer disease therapeutic plan, original plan. Now classical, conventional medicine, drugs and medical application protocol, but we want to some drugs only that's suitable for our Efruzhu anti-cancer medicine and laws. Theory 9 therapy regimens, components, main actors, drugs. Thank you very much. Thank you so much. This road very, very, very difficult, but patiently we will make deep, strong effort and step by step walking and point completely cancer disease, absolutely solution and treatment therapy. Thank you very much. Thank you so much. See you soon again.